Smart Care. Sustainable health for the future.
Poland is facing an uncertain future as its population ages, putting pressure on workers, the economy and the healthcare system. Living through that demographic shift are people like 42-year-old Monika Zientek, who has rheumatoid arthritis. What kinds of things do you expect to happen in the future in terms of your ability to carry on working, to be active and to do what you'd like to do?
My future is full of question marks and I'm full of worry about the future. That's linked to the fact that I don't know how my illness will evolve. I don't know how it will be monitored, what access to doctors I'll have. So there are lots of worries about the future.
As the country's population ages, so the number of people with chronic conditions like arthritis goes up. Those people often stop work well ahead of retirement age. Physiotherapist Ernest Wiśniewski helps people stay fit for work. He can't halt Monika's condition, but he can make a difference.
So here we have a clear problem in the joint. We can introduce mobilization into the joints, which will probably influence their flexibility, and affect the movement of the joints and the movement of the wrist.
The context in which this story is being told is one of demographic change across the EU. There's no nice way to say it, we're all getting older. If you look at the figures, at the moment there are 4 workers for every person who's retired. It's projected that by the year 2060 that will go down to 2 workers. And here in Poland there could be just 1 person working for every retiree. That challenge spurred Professor Boleslaw Samolinski to create a coalition of several hundred experts in medicine, economics and government healthcare to discuss the way forward. What's the one message that you would take away from those discussions that you've had with your coalition?
For me, probably the most important result of this project was to build awareness that politicians today have a mission to construct health security and the return of people to the labour market. The investments made in this area today will give positive results in 20 or 30 years' time. With that awareness in mind, what kind of action should be taken? We asked rheumatologist Professor Brygida Kwiatkowska.
We have to take concrete steps to deal with an ageing society. Firstly, improve the pro-family policy in Poland so that young people decide to have more children, or even children at all. Secondly, keep as many people of retirement age in the labour market as possible. Thirdly, prevent people leaving the labour market because of long-term illnesses.
Applying those changes across a country of 38 million people is a huge challenge, and one in which the voice of the patient has to be heard. What kinds of changes would you, as a patient, like to see happen in the healthcare system here?
As a patient, I would like there to be dialogue between the patients' associations and the organisations that decide on our treatments. Only with dialogue and collaboration are we able to overcome the barriers that arise.
As Poland's population ages, the importance of that dialogue and collaboration will only increase.
Smart Care, in partnership with AbbVie.